Okay, go ahead.
All right, so thank you everyone for coming out tonight. I'm gonna share a whole bunch of information with you. Don't worry about taking notes. I will share the slides afterwards. I've got websites and all kinds of information in there. So just sit back, relax, listen, soak it up, and you can pop questions in the chat at any time, and we'll just address them all in the Q&A period after I go through everything. So we're gonna talk about integrative oncology. So what the heck is integrative oncology? We'll start there. We'll talk about different areas of integrative oncology, beginning with mind-body therapies for people with cancer. And then we'll talk a little bit about diet, nutrition. We'll sort of cover all the bases, a little bit about exercise, and a little bit about natural health products and dietary supplements. All right, so first some definitions. It's important to understand the distinction between complementary therapies and alternative therapies, which are both sort of used within what used to be called complementary alternative medicine is now called integrative oncology. So within integrative oncology, we focus on complementary therapies. So these are interventions, products, procedures that are not traditionally part of conventional medical care, but they're used alongside conventional treatments. So that's the integrative part, is that we have the complementary therapies, we use them with the conventional treatments like surgery or chemo or radiation, et cetera. So these kind of therapies include natural health products, the mind-body therapies, exercise, nutrition, energy therapies, a lot of what I'll be talking about today. In contrast, alternative therapies are chosen instead of conventional care. So this is when maybe a person decides they're not going to do their chemo or their surgery. They go to Mexico or Germany and they, try these often unproven therapies that maybe cost a lot out of pocket. They're not always evidence-based, and so they're not integrated with conventional care. So those alternative therapies aren't part of what we call integrative oncology. So sometimes it's similar kinds of therapies, but with integrative oncology, they're used in combination with the conventional care, and they're largely evidence-based. So let's do a little quick poll. What proportion of people with cancer do you think use these complementary therapies? So you can put your answer in the chat if you want. A would be less than 10%. B would be about a quarter of people. C, about half the people using these therapies, or D, 3/4 or more. So you can pop it in the chat if you want. Oops, there we go. Let's see what we got. I see C, 25, A, we've got a whole range of stuff here. B, we've even got a D. All right, so there's a range of opinions and experience here. So let me tell you the answer. I can get this to go. The answer is C, about half of people. And that's people using these therapies since they've been diagnosed with cancer. So some of the data, a big study with 18 countries around the world showed a prevalence of about 46%, so just under half. In Canada, similar kind of data to the rest of the world. Here in Calgary at the Tom Baker, we did a big survey back in 2012 and found similar numbers. About a half, 47%, were using these therapies. And people who were more likely to use them were women, younger people who are more highly educated and living with cancer for a longer period of time. The most commonly used therapies were natural health products like vitamins, herbs, and supplements. And people were using these therapies to improve their quality of life, improve their immune system, increase feelings of hope. Some people were hoping they would help to cure their cancer. All right, so let's talk about this concept of integrative oncology now. So let's do another quick little poll. What do you think integrative oncology is? And you've maybe got the gist of it from what I'm saying, but let's see how you do on this quiz. A, it's the newer term for complementary and alternative medicine within oncology. B, it's a term used by non-MDs to promote the use of natural supplements in combination with conventional treatments. C, it means to integrate a variety of conventional cancer treatments, including systemic therapy and radiation. Or D, it's a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle. So you can pop your answer in the chat if you want. Oh, you guys are on the ball. Well, D, A is close. Yeah. I see a few more Ds. Okay, so D is actually the correct answer, but A is kind of partly correct as well. The definition of integrative oncology, part of it is right there in D. Here we go. So the Society for Integrative Oncology that I've been involved with for a long time came up with the definition, and just like it said in number D, patient-centered, evidence-informed field of cancer care that uses these different complementary therapies. The aim is to optimize health, quality of life, and clinical outcomes across the cancer care continuum. So that means from even before diagnosis, treatment, survivorship, end of life, and empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So that's the official definition. Within integrative oncology, like I said, we've got the three main areas: lifestyle modifications, mind-body practices, natural products. But the use of these are driven by patients' individual values, preferences, their right to choose their own treatment, experience that they may have had, clinical experience of the practitioners, and the research evidence. Of course, we always turn to that in integrative oncology. So I've already mentioned sort of the categories that we look at: lifestyle modifications. So here we have the exercise, physical activity, diet, sleep, stress management. And these are really your foundations of wellness that everyone has to take into account for their overall health, as well as the different mind-body therapies. Some of the more popular ones are meditation, yoga, acupuncture, tai chi, qigong, and the natural health products. So if you haven't seen it yet, I really recommend this book called Anti-Cancer Living, and it goes through what's called the mix of 6 protective factors. And there's also a website built around these same 6 factors called the Anti-Cancer Lifestyle Program. If you haven't been to this website, I highly recommend it. It's excellent. So here's the 6 factors. You're hearing these same things over and over. Maybe newer to the mix is love and support. So we know that having supportive social relationships is very important for overall health. And then they also talk a lot about environmental toxins. So how you can clean up your environment, get rid of the unhealthy plastics and sort of things that might be around your house and that kind of thing. It's good to learn about that as well, although I won't be talking so much about that today. So I'm going to hone in now on the specifics around the evidence for different mind-body therapies. So what are they? Mind-body therapies are a variety of techniques. They're designed to enhance the sort of connection, the mind's capacity to affect your bodily function and the symptoms you experience physically as well as mentally. So mind-body therapies are based on the premise of recognizing the interconnection between your mind, your thoughts, your feelings, and what happens physically in your body. So your nervous system, your immune system, your hormones, everything is intimately interconnected, including now, your gut and your microbiome as well. So to simplify it, I like to say that every state of mind has a state of body, and every physical state of body affects your mind, your moods, your thoughts. So these mind-body techniques are ways to regulate that mind-body connection. They're appealing to people often for reducing symptoms, and they're effective or can be effective for managing stress, anxiety, pain, fatigue, sleep disturbance, some of the biggest problems that people with cancer are dealing with. And this is distinct from traditional medical management, which is usually a pill, right? So we're talking about pain-killing pills, stimulators if you're fatigued, sedatives if you're anxious, antidepressants if you're sad, right? But not everybody likes this approach. It can be effective for many people, but it may also interact with other medications you're having or cause more unwanted side effects. So many people are looking for non-drug alternatives that might be able to treat these symptoms as well. So here's a list of the sort of usual suspects around mind-body therapies. So meditation or mindfulness meditation is quite popular now in the literature. Yoga, there's different styles of yoga, but there's some that's been adapted for people with cancer. Hypnosis, I'll talk about in a little bit, as a sort of a focused state of absorption of the mind. We can use relaxation with or without imagery to help us manage the sort of physical level of anxiety in the body. And then creative therapies are really good for some people. So music therapy, visual arts, sculpture, painting, drawing, dance, movement. And then other therapies that are sometimes included under this umbrella are what are kind of more energy therapies like acupuncture, tai chi, qigong, that come from traditional Chinese medicine, or Reiki and therapeutic touch, which the Reiki comes from Japan. It's an energy therapy as well. And reflexology or reflexology massage is also sometimes utilized here. So I'm going to kind of go through the main categories that have, a lot of evidence support to them. Just turn that off. I'll start with meditation or mindfulness. So I've given talks before at Wellspring about mindfulness, and you may have heard, other people speaking about this, but sometimes there's a lot of misconceptions around what really is mindfulness because it's so much in the popular media. So the simplest definition is just paying attention on purpose in the present moment with an open and accepting attitude. So mindfulness is a way of being in the world. So you can be more or less mindful, like paying attention no matter what you're doing, right? You can be mindfully washing the dishes or washing the dishes and thinking about a million other things. It's also a practice of mindfulness meditation. So the purpose of practice of sitting down and training our minds in the capacity to pay attention, because it's like a skill. So mindfulness is something you learn how to do, how to be more present in the moment and applying the attitudes of kindness and non-judgment. So this is an example of a way of being in the world, and you can see the person and the dog, they're having a walk, and you can see what's on the person's mind and what's on the dog's mind. And so the question is, who's more mindful? And the dog obviously wins the contest in that case because the dog is in the present moment, seeing exactly what's in front of them, whereas the person's mind could be anywhere in the past or the future, all kinds of worries and concerns. And this diagram is just an illustration of the practice of mindfulness. So setting aside time to train ourselves through meditation in that capacity for mindfulness. All right, so what is the evidence around the benefit of these practices for people going through cancer? This is a good article from the scientific literature from, in fact, the premier journal of clinical oncology, that it comes out from all the Association of Clinical Oncologists in the United States, which is represents 60,000 oncologists around the world. And so they have endorsed the recommendations from the Society for Integrative Oncology around integrative therapies. And in this particular guideline, the meditation, so particularly a form of training in meditation called mindfulness-based stress reduction or mindfulness-based interventions. These are multi-week programs, group programs that train people in the skills of mindfulness over a period of 2 or 3 months. So this kind of program is recommended for treating mood disturbance and depression symptoms with a very high grade of certainty. It's also recommended for reducing anxiety, and also for improving quality of life in these guidelines. So you'll be happy to know that both Wellspring actually and Alberta Health Services have mindfulness-based cancer recovery programs, which is training in mindfulness that's specifically tailored for the kinds of issues people with cancer are often facing, like things like fear of recurrence and fatigue and sleeplessness. So this mindfulness-based cancer recovery is offered both virtually and in person a few times a year through Alberta Health Services, through psychosocial resources, so you can find it online. And Wellspring also offers the mindfulness-based cancer recovery program. So I hope everybody signs up for that one way or another. It's definitely beneficial for many people. Okay, let's turn to yoga. So I like this cartoon, relaxing pastime, spiritual path, or extreme sport. So in addition to there being many misconceptions about mindfulness, there's often misconceptions about yoga that, you're standing on your head, wrapping your leg around your shoulder or something crazy like this cartoon shows. But the kind of yoga that's usually used in studies for people with cancer is very gentle, like therapeutic type of yoga, where it's really very simple movements that are done slowly and really paying attention. So yoga employs movement, both breath, awareness, breath exercises, and some form of mindfulness practices. And it gives the yoga practitioner tools to regulate their nervous system, regulate their mind-body connection. And there's many different styles or types of yoga. So you can think about where a yoga practice falls on the physical intensity scale. So some are easier and some are more strenuous. So there's physical elements, including the poses, which are called asanas, the different stretches. And so a therapeutic yoga practice is much easier on the physical intensity side, whereas something like power yoga or Ashtanga yoga is much more strenuous and intense. And yoga also has a spiritual element. So it can, again, range from being very secular, more like a gym class, versus more traditional, which has more sort of ceremony, more sort of tied in with the spiritual or religious aspects through the meditations or the breathing exercises. So you can shop around and find a yoga class that fits on those two elements of the spectrum that harmonizes most with, your preferences and beliefs. So also yoga is recommended for reducing anxiety. And you'll see a lot of the mind-body therapies can treat similar symptoms like anxiety and depression. So which one to choose is really often a matter of personal preference. Yoga also can improve mood disturbance, things like anger, sadness, depressive symptoms, tension. And it's also recommended for improving overall quality of life. And there's also research showing that yoga can be helpful for fatigue, which is a big problem for many people with cancer. So Yoga Thrive is a program that's available here in Calgary. It's a research-based therapeutic yoga program for cancer survivors. So it's specifically designed for people with cancer and their support people. It's a 12-week program. It's based on traditional Hatha yoga, which is one school of yoga, but it's modified for people with cancer. So it's quite doable for anybody, no matter where you're at in your treatment, even if you have some limitations. And the research shows that there are benefits in overall mood, stress, physical strength, and quality of life. So you can go to this health and wellness website through kinesiology. It's Dr. Nicole Koulos-Reed and her group who offers these classes. And there are Yoga Thrive programs. There's yoga teachers trained all over Alberta now. So there's many places you can find those programs, as well as at Wellspring. Okay, like I said, it's a whirlwind tour here. We're going to move on to relaxation. So relaxation is a wide range of therapies, but really no matter how you do it, they're designed to elicit a state of freedom from mental or physical tension. So really, we're just finding a way to relieve the physical tension in the body, to calm down the racing mind a little bit. And so symptom improvement occurs just by eliminating that tension, the emotional stressors, helps people to sleep. There's different standardized forms of relaxation, like progressive muscle relaxation, which is where you go through and you tense body parts. You might tense your fists, hold it really tight, and then as you exhale, you relax. So you're really feeling the contrast between tensing a body part and then releasing. So PMR, that progressive muscle relaxation, just sort of takes you through the whole body doing that. So you can do that on your own, or you could find a guided script online to do that. And then there's also the relaxation response, which is very similar to kind of a mindfulness meditation, sort of awareness of breathing and releasing tension. So when we do these relaxation exercises, it activates the parasympathetic nervous system, which is just the opposite of the fight or flight. So the fight or flight is what gets you, you're driving along and a dog runs in front of your car. Whoa, all of a sudden, zing, your heart starts racing, your palms are sweaty. That can be activated too when we worry about the future, we've got an appointment coming up, that kind of thing. So the parasympathetic is the relaxation response, which is the opposite of that stress response. So your heart rate decreases, your breathing slows down, your blood pressure decreases. You feel much more calm when you activate that relaxation response. Now, guided imagery is often used along with relaxation, and this is really where you are engaging all your senses to imagine either, well, you can use all your senses. So it can be visual. You imagine a scene, it might be a pleasant scene like a lake or a mountain, that kind of thing. And then you can bring in your other senses. So like hearing the birds or the rustle of the leaves, smelling the fresh pine scent, the taste of the crisp air. So bringing in all your senses really engages more in that imaginary experience. So yeah, for example, imagining your happy place with all the different senses. Other ways you can use imagery is to, for example, manage pain, and you could imagine like a thermometer or a volume knob, and imagine it going, if it's a thermometer, from like red hot to just cooling down. So you can use that imagery to also help control some of those symptoms. And studies show that it's more effective than nothing, like doing nothing, for reducing depression, anxiety, discomfort, quality of life, and pain, as I mentioned. So hypnosis, this cartoon is sort of showing you, again, a misconception about hypnosis, right? As if the psychiatrists sort of make the person float and they'd have no memory of doing whatever they do. That's really a misconception. Medical hypnosis is really just elucidating this natural state of aroused, attentive, focal concentration. So it's a form of absorption or intense concentration. And so we're suspending our sort of peripheral awareness and focusing on whatever the attention is on. It's usually some kind of symptom control in a medical hypnosis. So it's very goal-oriented and maybe more focused than imagery or relaxation. It's often used for pain control, and there's been great studies using it, for example, in surgical biopsies or like dental procedures, where the hypnosis is just as effective as pain medications for managing those procedures. So here's the example of a study where people were getting a breast biopsy, and they either got just a brief pre-biopsy hypnosis session, or they had just someone to talk to, an empathetic listener who didn't do hypnosis. And so they went through the procedure, and it turns out that the people who had this brief hypnosis had less pain, they were less discomfort, they had less fatigue, less distressed, and they actually recovered quicker after they had the biopsy, the people who had the hypnosis. So it's pretty interesting. There's a number of studies along those lines. So again, switching gears to something that's a mind-body therapy that's a little bit different is the creative therapies. And many people already have experience with creative outlets. And so, if you're someone who like to paint or draw or do those kind of things, dance or movement, it can be a really good way to help process all the different emotions around difficult experiences like going through cancer. So just facilitating creative ways to express and process these feelings and emotions. So there's a whole range of different ways you can express yourself creatively, music therapy, both just listening to music, but also creating music, writing lyrics, the visual arts, the drawing, painting, sculpting, all kinds of things like that. Expressive writing or journal writing, many people like to do, which can be a great way to make sense of your feelings and process emotions, and movement or dance therapy as well. And I know Wellspring offers many of these. So Tai Chi, again, slightly different. This comes from traditional Chinese medicine. I'm sure many of you are familiar, either you've done the Tai Chi practice or you've, seen people doing it. So it's a series of slow movements. They're called forms. They're kind of a prescriptive sequence of movements that you go through in kind of a really focused meditative fashion. So you're focusing the mind on the movements, and that brings about this state of calm and clarity. It's also actually really good for working on things like balance and that sort of thing. So it originally came as a form of a martial art, but now it's more taught as a health behavior practice or just a form of very gentle exercise. And lots of research on Tai Chi has been with elderly people. And it shows it can help with balance, help preventing falls, when older people often become a little more wobbly, and it's those falls that can often lead to hospitalizations and that kind of thing. So you really want to prevent those, and improving overall well-being. Qigong is, I guess, a variation on Tai Chi. It comes more from the medical side of traditional Chinese medicine than the martial arts side. It's meant to cultivate balance of Qi, which is your life energy. And so with Qigong, it's maybe less about form or specific movements than Tai Chi, and it's more about aligning breath, it's very simple movements and awareness. And it's meant to foster healing and meditation. So there's usually the three components. There's a posture, and it can be still or just sort of moving back and forth maybe. And there's some kind of breathing technique and some kind of mental focus on moving the energy through the body. And studies show that Tai Chi or Qigong can also improve mood, fatigue, quality of life. And often Tai Chi and Qigong are combined into a type of practice that's called Tai Chi Qigong or TCQ. So this summarizes all the therapies I just talked about, which symptoms they're best suited for, other potential effects they may have. Yeah, so you can, look this up if you want to look at the scientific literature more, but you can see that it's listed all the ones I went through, what the strongest effects are. So for many of them, they're good for anxiety, depression. And then there's other things they may affect as well, things like your cognition or thinking, what's happening with biomarkers like your immune function and that kind of stuff. All right, acupuncture is something that also deserves special mention because it's a really effective way to treat pain. So acupuncture comes from traditional Chinese medicine as well. It's relatively low risk of side effects or adverse events, and many acupuncture protocols, they just use sort of your arms and your legs. So it can be done in a group setting. We've done a study like that. And, oh, there we go. Hold on. let me get this back. It's skipping ahead. Give me a second. There we go. So this is kind of a busy slide, but it's actually summarizing, again, the guidelines from the American Society of Clinical Oncology for pain management specifically. So which integrative therapies are best for pain. And so the way this is set up is that it talks about the different kinds of pain here. So there's pain related to taking aromatase inhibitors, like anastrozole and things like that, that you might have to have after breast cancer treatment. And that can cause these pain in the joints. So yoga and acupuncture can be helpful there. Just general cancer pain, so nothing super specific. Acupuncture can be helpful. Reflexology or acupressure, massage, yoga, and guided imagery using progressive muscle relaxation. CIPN, that's chemotherapy-induced peripheral neuropathy. This is a real tough kind of pain to treat. So that's when you've had chemotherapies that affect the nerve endings, usually in the fingers and the toes. So they get kind of numb or they tingle or they're painful. So that's neuropathy. And it's a difficult pain to treat, but acupuncture shows some promise in this area as well. I talked about hypnosis helping for procedural pain. So when you have those biopsies or something like that. And post-surgical pain, again, acupuncture can be helpful with that. And music therapy can also help in those procedures to calm you down a little bit and manage the pain. And this is all based on the research evidence, right? So that's the types of recommendation, the evidence quality, and the strength of recommendation. And so there hasn't been as much research in a palliative care setting or with advanced cancer, but some research shows massage is helpful for pain there. And likely the other therapies like acupuncture are as well. There just hasn't been enough research to say that with any certainty. Okay, so that's mind-body therapies. Now I'm going to shift again and we're going to talk a bit about diet and nutrition. And this is all very high-level stuff, and we can get into more details if you have questions afterwards. So there's so much out there. You should eat this, you shouldn't eat that, bad food, good food, sugar, this, that. So it turns out that a lot of people pursue special diets during cancer to, try and optimize their outcomes. And unfortunately, the research on what diets people use and which are helpful is very sparse. So if you can look at, this is kind of interesting, common diets back in 2002. And there's fad diets too, right? So there was vegetarianism and veganism, which carries over now. There were things like the Atkins diet back then, which was this really high protein. I guess the ketogenic diet is similar to that. There was macrobiotic diet where you're trying to get certain nutrients in there. There was the zone, the Pritkin diet, Ornish, and now people are talking about the paleo diet, Mediterranean alkaline. So there's all kinds of, I don't know, some of them are fad diets, and certainly some of them adhere to the core principles of what we actually now know about nutrition. And I think the best take-home message is that there's no fad diet that's the best. But what is the best is common sense. Stuff that, you have known probably your whole life and that your grandma said is eat your fruits and veggies. That's actually the best advice that you can get around diet. So I'm going to point you to this website, the American Institute for Cancer Research. They do a whole bunch of work on diet and cancer prevention and treatment. And they have a whole section on their website that's got all kinds of stuff. So you can see it's got healthy eating, food facts, recipes, supplements, nutrition. So definitely head there and do some poking around. So what do their guidelines say? They say eat fruits and vegetables and whole grains and beans. Not a surprise. Do not drink alcohol at all if you can avoid it. If you are going to drink it, this is less than 2 a day. It's actually now less than 2 a week because there's been new research coming out linking alcohol consumption to increased risk for some cancers. So limit your alcohol. You should never be drinking, pop, like sugar sweetened drinks. Avoid those. Fast food and processed food, avoid that. We can talk more about what that is. Nowadays, people talk about ultra processed foods. Basically, in the grocery store, shop around the aisles, right? Get the whole foods. Red meat does increase risk for certain types of cancers. So avoiding red meat as much as you can and not having processed meat at all, if you can avoid it. And through all of this, maintaining a healthy body weight. So what is processed meat anyway? People often don't like these guidelines around the meat. It's defined as any meat preserved by smoking, curing, or salting with the addition of chemical preservatives like sulfites and stuff. So bacon, salami, sausages, hot dogs, lunch meats, pepperoni, ham, those are all processed meats and should be avoided if at all possible. So does this really make a difference? It really does. So this is one study of over 361,000 people. So it's a lot of people. This was 7 European countries that followed people over time, looked at how they ate, and if they adhered to recommendations around diet. So there was 4 recommendations. Avoid the sugary processed foods, so that's energy dense foods, eating more plants, avoiding red and processed meats, and alcohol. So those were the sort of 4 things they looked at in this study, and they looked at how those things related to cancer mortality, so death from cancer. And these numbers here might not make any sense to you, but what they're saying is that for each thing of those 4 things they do better, it decreases mortality by 6%. So if you do one of those things, 6% increase in lifespan. If you do 2 of those things, 12%, 3 of those things, 18 or 24%. If you're doing all 4 of those things, those people are living 24% longer. Okay, there's also, so a lot of that is for just sort of general health behavior over time. They've also looked at dietary guidelines for people during treatment. And so both the National Cancer Institute and the National Comprehensive Cancer Network provide these basic nutritional guidelines for people during and after cancer. They're very similar to what I've talked about. And so I'm just going to give you a few really good resources on nutrition. They're kind of fun and interesting from these organizations I've already mentioned. So there's a quiz you can do at the AICR website to actually rate your diet. So how healthy is your diet? And it also has lots of videos and information. There's also the next one is the Healing Works Foundation. They have these cool pocket guides on all kinds of things. And so they have one on nutrition and cancer you can download. If you have, I did mention anti-cancer at the beginning. So the anti-cancer lifestyle page also has a lot of information on diet. And then the other one I would always recommend is cancerchoices.org. So they're a great organization as well. And they have good information on diet as well. So you can spend many, many hours digging through these resources, but these are trusted resources that are evidence-based. All right, I'm going to shift now to physical activity. And so the tide has shifted on this as well. Many years ago, it was like, oh, you're going through cancer, just rest, don't overtax yourself, take it easy. But we actually now know that trying to maintain or even ramp up physical activity is actually the healthiest way to go through cancer. So we know it's safe and it's beneficial across all stages of the cancer continuum. Yet very few people with cancer meet guidelines for recommended amounts of activity. Only 10% during treatment and maybe only 20 to 30% after treatment. And many surveys have showed this. So it's important to sort of find ways to bring activity into your life that are not too strenuous, that are enjoyable, but can really make a big difference to many different outcomes. So it improves how you feel about yourself, your self-esteem. It's good for your mood. It can maintain your muscle mass that you might lose from inactivity or all those nasty treatments. It reduces the risk of osteoporosis, so lowered bone density, which can increase your risk of breaks if you have falls. And it can even improve that chemotherapy-induced peripheral neuropathy. I talked about the tingling in the fingers and the toes, lymphedema, which is swelling caused by some treatments where they take out the lymph nodes, improves fatigue. In fact, exercise is the #1 recommended treatment for cancer-related fatigue and can improve your balance. So what do we mean by physical activity? Let's see what we've got on here. And it's not as bad as it might sound. So this is a good website to look at that's called Exercise is Medicine. And their whole mission is to get the medical community to think about exercise the way you would think about a pill, a drug. If there was a drug that had the benefits of exercise, everyone would be on it, right? And so it's hard to see this, but what this sort of, oops, sorry, what this chart is showing is that it's got, I don't know if you can see my mouse here or there, but it's got the different outcomes, and it shows where there's strong evidence, and it shows the dose. So if you're going to do aerobic activity only or resistance activity only, that's like lifting weights. And if you want to do both, this tells you the exact doses. It doesn't need to be this complicated, and I think I've got a simpler slide coming up. But it shows you that there's strong evidence for treating fatigue if you just do 30 minutes per session, 3 times a week of aerobic activity. And it needs to be in the moderate range. So moderate aerobic activity is anything that gets you breathing a little bit hard, but you can still carry on a conversation. So that's moderate aerobic activity. And that could be walking up and down your hall if you're feeling really fatigued during treatment, right? That could be moderate aerobic activity. Could be walking around your block. It could be going up and down the stairs. It could be going on a treadmill. It could be going for a swim. So anything that increases your heart rate for 30 minutes, 3 times a week is going to benefit you in terms of your fatigue, and similar things for quality of life, physical function, anxiety, depression, etc. So if you go to that website, you can sort of see all the details on this. And I'm going to show you some exciting new data actually about reduction in mortality with exercise in cancer that was just published yesterday, but it confirms what this chart is summarizing. And what this chart is summarizing is that as you do more exercise, so the green is your moderate exercise and the blue is more vigorous exercise, so where you're huffing and puffing a little bit more, it can reduce your risk if you do, like, say, let's go here. So about 400 minutes a week. So that's about, even if you did 30 minutes a day, 37% decreased reduction in mortality if you do that amount of moderate exercise every week. So this was not so this is observational data. So the difference between what I'm going to show you in a minute in a clinical trial and observational data is that there's lots of other stuff going on, obviously, for people too, when they choose to exercise or not to exercise, right? So the observational data shows that, yes, people who've been diagnosed with cancer, you follow them up, those who are walking more or doing more exercise, they survive longer. But you could also say, well, they're doing more because they're not as sick, and that's why they survive longer, right? So this data is compelling, but it's not definitive. But we are seeing this risk in mortality with the observational data. And so now let's look at the more clinical trials data. So this is a publication from 2023 and by an authoritative figure in the field. And he's saying that regular exercise appears to act like a good double whammy. So it reduces the risk of dying from certain cancers, and the side effect reduces the risk of dying from causes other than cancer. And so that's because people who exercise after cancer treatment are less likely to get a cancer recurrence, but they're also less likely to die from other things like heart disease. And so this challenge study just came out yesterday in the New England Journal of Medicine, and it's important because it used a randomized design. And so it took a big group of people. In fact, it was 889 people. They had colon cancer and they were post-surgery. So all these people were from the same pool, they were in the same situation, but half of them were randomized to exercise for 3 years, 445 of them, and the other half got just educational materials about the value of exercising. But the ones who were in the exercise program had a dedicated exercise professional, a leader who exercised with them once every 2 weeks for a whole year, and then monthly for 2 more years. So they had a personal trainer. So they followed these people after they did the intervention for 3 years. They followed them for another 7 years to see what happened with their cancer recurrences and also their overall mortality. So what happened? The people in the exercise program had a 28% lower risk of recurrence. So they were 28% more likely not to have a cancer recurrence. And they also had a 37% lowered risk of death from all causes, right? So diabetes, cardiovascular disease, stroke, everything else. So this is the first really large randomized clinical trial to prove that exercise like this improves survival. So it's a really important study that took a long time to do, but it's basically kind of a no-brainer in many ways, because that's what all the other evidence has been showing us too. So that's something you can really do to help improve your chances and improve your quality of life. So let's just summarize the guidelines. So it's about 150 minutes of that moderate intensity aerobic physical activity per week. Again, it can be walking around the house, walking around the block, anything like yoga, if that gets your heart rate going a bit. It can be swimming. It can be an exercise bike. Lots of people like biking, even e-biking around if you're pedaling, right? So 150 minutes, 30 minutes a day about. Or if you want to be more vigorous about it, you don't have to do as much. So 75 minutes of more vigorous intensity activity. That meets those guidelines. And you don't have to do it all at once. So you could do 10-minute walks with your dog 3 times a day at a pretty brisk pace, and you'd be getting your recommended amount. Oops. Oh, what happened there? Okay. All right, so this is back to the Exercise is Medicine website, and this is another infographic that summarizes the benefits of different types of exercise. And the interesting thing here, so I talked about aerobic exercise, but there's been a lot of interest lately in looking at, well, what about weightlifting? What about more resistance exercise? And even walking around like with a weighted vest, or having weights in your hands when you're walking around. And it turns out that the symptoms that they help with are a little bit different. So this bottom part is showing you that the aerobic exercise helps with all these colors here that correspond to up here. And the resistance, for example, helps more with lymphedema, and helps more with bone health, for example, right? Preventing osteoporosis, if you do a little bit of that weight training. So you can look at these kind of guides and figure out what's going to be the best approach for you individually. And the main thing about exercise that's important is that you do it. So find something you like, right? If you don't like it, if it's a misery to go to the gym, you're not going to do it. So find something that you enjoy, set up a daily walk with your friends or your dog walkers, or meet at the gym or the yoga class or the aquafit, right? And just get out there and do it. I think we already looked at this one. Yeah, we did. Okay, and also during cancer treatment, physical activity also improves quality of life, depression, anxiety, fatigue, lymphedema, CIPN, and there are guidelines for exercise during treatment. And that was controversial for a while, is maybe people should wait until after treatment. No, it turns out that during treatment, whatever you can do, you should do. So specific guidelines is that both aerobic and resistance exercise should be recommended during active treatment to mitigate side effects, and even pre-operative exercise. So they've done studies mostly in people with lung cancer. So this is in that period between when you get the diagnosis, and sometimes there's a gap before maybe there's a surgery. You could do exercise then, and it might help you recover better from the surgery. So now they're trying to promote exercise prescriptions, so that your doctor would actually, instead of handing you a prescription for some medication, they would hand you a prescription for exercise. And it would be specific. For example, if you had fatigue, start with 5 to 10 minutes of light activity 2 or 3 times a week and gradually increase. So that would be your exercise prescription. We have the Alberta Cancer Exercise Program across Alberta. That's always recruiting new people or entering new people in the program. So it's a supervised exercise program for 12 weeks. It can be in person. It can also be done online. So you can look it up under the Alberta Cancer Exercise website. All right, I'm almost done talking here. Let's talk a bit about nutritional supplements. This is going to be pretty high level. People are often looking for the magic pill. Oh, I heard if I take curcumin, or I do this or that, so many people use different vitamins and minerals as supplements. You can see the numbers there, they're quite high. Unfortunately, there's not been a ton of research in this area, and for a variety of reasons. So we don't know a lot about which dietary supplements might be helpful, which might be harmful, if there's drug interactions. So often the recommendation is to stick with foods that are high in the nutrients that you're trying to get from your supplement, right? We know that things like vitamin A, vitamin E, they're antioxidants, are very beneficial in many ways, but it's safer to get them through food than through supplements. Some promising supplements, we do know that everyone should take vitamin D. The dose is sometimes up for grabs, but the basic dose everyone should take is about 2,000 milligrams per day. And there are some people who suggest really high doses of vitamin D or intravenous vitamin D. But we do know that some vitamin D is likely good. Probiotics are also something that can help with some of the GI symptoms. And we're actually, I should have put a thing in here, we're actually recruiting for a clinical trial right now at the Arthur Child for cancer survivors who have GI symptoms. So if you're having difficulty, with upset stomach, diarrhea, bloating, gas, those kinds of things, we're doing a study where you will either get a probiotic to take for 6 weeks, or you'll get a pill that looks just like the probiotic, but it's a placebo. And you take it and you monitor all your symptoms and see if it helps. Because there's some evidence that probiotics might help, but there is not enough clinical research. So we're adding to that research right here in Calgary by doing that trial. I can give you more information if anyone's interested. So how do we approach supplement use? Think about what's the purpose? Why are you taking it? A lot of times people might be taking supplements and they don't actually know why or what they're for. Who manufactures it, to make sure that it's following clean manufacturing processes, make sure the information is accurate. What kind of research has been done on the supplement? Do we actually know that it's helpful in people with cancer? What are the side effects or the interactions we need to be careful for? And are there safer ways to achieve the same effect, and maybe cheaper ways too? So again, I know I've given you lots of websites, but there's a lot of information out there. We want to give you accurate and reliable information. So there are some very good websites. The one I really like here at Memorial Sloan Kettering Cancer Center. They're one of the largest cancer centers in the States, in New York. It's called About Herbs. There's an app and there's a website, and you can go on there and put in any supplement you want, or any symptom or side effect. Like you put hot flashes and like 25 things will come up, and you can read about them and what the research shows they can do for your hot flashes. So you can do it both ways. You can put in curcumin, see what it's good for. You can put in a symptom, see what might help it. And it goes through all the herbal supplements, really handy. There's other ones that are very similar here that you can look at. Some of these are more for healthcare providers, but a lot of them are no cost, so you can check those out as well to get more information. Yeah, and we made it through the slides, so that is it. I will stop sharing. And certainly happy to answer any questions around that, because I know it was a pretty quick run through.